Question 1. The investigation demonstrates a lapse in the facility's protocol for managing a newly admitted inmate presenting with symptoms suggestive of active tuberculosis. Despite the inmate reporting a history of exposure and exhibiting a persistent cough, the medical unit failed to initiate immediate airborne infection isolation precautions or promptly order diagnostic testing for TB. Instead, the inmate was placed in general population housing for 48 hours before a chest X-ray was ordered, which subsequently confirmed active TB. Which of the following actions, if taken by the correctional medical staff, would represent the most appropriate and compliant response to this situation, adhering to established correctional healthcare standards and public health guidelines for communicable disease management? Option A. Immediately place the inmate in airborne infection isolation and initiate prompt diagnostic testing for tuberculosis, including sputum collection for acid-fast bacilli, AFB, smear, and culture, while simultaneously notifying the facility's public health liaison. Option B. Conduct a thorough medical history review and rely on the inmate's self-reported symptoms to determine the necessity of isolation and testing, deferring further action until a routine medical screening appointment. Option C. Implement universal precautions for all inmates and staff within the facility as a general preventative measure, without specifically isolating the symptomatic inmate or prioritizing TB testing. Option D. Disclose the inmate's suspected TB status to correctional officers and other inmates in the immediate vicinity to ensure awareness and facilitate their self-monitoring for symptoms. The correct answer is A. Immediately place the inmate in airborne infection isolation and initiate prompt diagnostic testing for tuberculosis, including sputum collection for acid-fast bacilli, AFB, smear, and culture, while simultaneously notifying the facility's public health liaison. Explanation. This scenario presents a professional challenge due to the inherent tension between maintaining public safety within a correctional facility and upholding the medical privacy and rights of incarcerated individuals. The management of communicable diseases like HIV, TB, and hepatitis requires a delicate balance of robust public health protocols, adherence to specific correctional healthcare standards, and respect for patient confidentiality. The Certified Correctional Officer, CCO, in the medical unit specialization must navigate these complexities while ensuring the safety of staff, other inmates, and the broader community, all within the strict confines of applicable regulations. The correct approach represents best professional practice because it prioritizes evidence-based medical protocols for disease management and containment, coupled with strict adherence to privacy regulations. This involves accurate screening, timely diagnosis, appropriate treatment, and diligent infection control measures, all while respecting the individual's right to privacy as mandated by correctional healthcare guidelines and relevant public health laws. This approach ensures that public health is protected without compromising the ethical and legal rights of the incarcerated population. An incorrect approach that fails to implement universal precautions and standard infection control measures for all inmates, regardless of known status, is a significant regulatory and ethical failure. This oversight increases the risk of transmission within the facility, violating correctional health standards that mandate proactive prevention strategies. Another incorrect approach that involves disclosing an inmate's HIV, TB, or hepatitis status to unauthorized personnel or other inmates is a direct violation of medical privacy laws and ethical codes governing healthcare within correctional settings. This breach of confidentiality can lead to discrimination, stigma, and a breakdown of trust, undermining the effectiveness of treatment and public health efforts. Furthermore, an approach that delays or denies necessary diagnostic testing or treatment based on non-medical factors, such as an inmate's behavior or perceived risk, is a failure to provide adequate medical care, contravening correctional healthcare standards and potentially violating inmates' rights to health. Professional decision-making in similar situations requires a systematic approach. First, identify the core issue: managing communicable diseases in a correctional environment. Second, consult the specific regulatory framework governing correctional healthcare and public health in the relevant jurisdiction. Third, assess the situation based on established medical protocols and correctional policies. Fourth, prioritize actions that balance public safety with individual rights, ensuring all interventions are medically sound, legally compliant, and ethically defensible. Finally, document all actions and decisions meticulously. Question 2. Upon reviewing an inmate's medical record and observing their current presentation, you note a history of opioid dependence and current complaints of severe muscle aches and tremors. The inmate also appears agitated and has track marks on their arms. Based on your training as a certified correctional officer, CCO, with a medical unit specialization, what is the most appropriate course of action? Option A. Document the track marks and agitation, but focus only on the muscle aches, referring the inmate for a general medical checkup without mentioning the potential substance abuse history. Option B. Administer over-the-counter pain medication for the muscle aches and advise the inmate to rest, assuming the symptoms are unrelated to substance abuse. Option C. Initiate a substance abuse screening, document all observed symptoms and your action, and immediately notify the medical unit supervisor for a comprehensive medical and substance abuse evaluation. Option D. Inform the inmate that their history of substance abuse is not a medical issue and that they should manage their symptoms independently. Correct answer is C. Initiate a substance abuse screening, document all observed symptoms and your actions, and immediately notify the medical unit supervisor for a comprehensive medical and substance abuse evaluation. Explanation. This scenario presents a common challenge in correctional healthcare, balancing the immediate medical needs of an inmate with the long-term implications of substance abuse and the legal requirements for documentation and referral. The correctional officer must act decisively while adhering to established protocols and ethical considerations. The correct approach prioritizes a comprehensive assessment and appropriate referral, aligning with best practices in correctional medicine and the likely regulatory framework governing a certified correctional officer, CCO, with a medical unit specialization. This involves recognizing the potential for substance abuse, initiating a preliminary assessment within the officer's scope of practice, and ensuring the inmate receives a formal evaluation by qualified medical or mental health personnel. This approach respects the inmate's dignity, promotes their well-being, and ensures proper documentation and follow-up, which are critical for effective treatment and institutional safety. It also adheres to the principle of providing appropriate care within the correctional environment. An incorrect approach that focuses solely on immediate physical symptoms without considering the underlying substance abuse issue fails to address a significant contributing factor to the inmate's health status. This could lead to incomplete treatment and a higher risk of relapse or further complications. Another incorrect approach that involves withholding information from medical staff or making a definitive diagnosis without proper training and authorization violates professional boundaries and regulatory mandates. Correctional officers are not authorized to diagnose medical conditions, including substance use disorders. Furthermore, failing to document the observed symptoms and actions taken is a critical regulatory and ethical failure, as it compromises accountability, continuity of care, and potential legal defense. Professionals should employ a decision-making framework that begins with recognizing potential issues, assessing the situation within their scope of practice, consulting with appropriate personnel, documenting all observations and actions, and ensuring proper referral for specialized care. This systematic approach ensures that all relevant factors are considered, leading to the most effective and compliant outcome for the inmate and the institution. Question 3. The monitoring system demonstrates an inmate in the medical unit exhibiting signs of acute distress, clutching their chest and appearing to struggle for breath. The correctional officer on duty is responsible for the security of the unit and has observed the inmate's condition worsening over the past few minutes. The inmate is requesting immediate assistance, but the designated medical staff are currently attending to another urgent case in a different part of the facility. Which of the following actions best fulfills the correctional officer's roles and responsibilities in this situation? Option A. Continue with routine security rounds, assuming the inmate will eventually be seen by medical staff when they become available, as the officer is not authorized to provide medical treatment. Option B. Attempt to administer a pain reliever from the general supply cabinet, believing it might alleviate the inmate's symptoms, and then report the incident later. Option C. Secure the medical unit by locking the door from the outside to prevent any unauthorized access to supplies, and then radio for medical assistance. Option D. Immediately contact the medical supervisor and the facility's emergency response team, while remaining with the inmate to provide reassurance and observe their condition until medical personnel arrive. Correct answer is D. Immediately contact the medical supervisor and the facility's emergency response team, while remaining with the inmate to provide reassurance and observe their condition until medical personnel arrive. Explanation: this scenario presents a professional challenge due to the inherent conflict between maintaining security and ensuring the well-being of an inmate requiring medical attention. The correctional officer's primary responsibility is to uphold institutional safety and order, which includes preventing unauthorized access to medical supplies and ensuring the security of the medical unit. However, they also have a duty of care towards inmates, particularly those with medical needs, which necessitates facilitating appropriate medical treatment. The officer must balance these competing obligations without compromising either. The correct approach represents best professional practice because it prioritizes the inmate's immediate medical need while adhering to established protocols for handling controlled substances and medical emergencies. This involves promptly notifying the appropriate medical personnel and supervisors, thereby ensuring that the inmate receives timely and professional medical care. This action aligns with the correctional officer's role in facilitating medical treatment and upholding the inmate's right to health services, as mandated by correctional standards and inmate welfare guidelines. It also ensures that the security of the medical unit and its supplies is maintained through proper channels. An incorrect approach that involves ignoring the inmate's distress and continuing with routine duties would be a failure of the duty of care. This neglects the inmate's immediate medical needs, potentially leading to a worsening of their condition and a violation of inmate welfare regulations. Another incorrect approach, such as attempting to administer medication without proper authorization or training, would violate protocols regarding the handling of prescription drugs and could lead to serious harm to the inmate, as well as disciplinary action for the officer. Furthermore, attempting to secure the medical unit by locking out the distressed inmate would be a severe ethical and regulatory failure, as it prioritizes security over a clear and present medical emergency, potentially causing irreparable harm and violating inmate rights to medical care. Professionals should employ a decision-making framework that begins with assessing the immediate situation and identifying the primary concern in this case, the inmate's medical distress. This assessment should then trigger a review of relevant institutional policies and procedures regarding medical emergencies and the handling of controlled substances. The next step involves prioritizing actions based on urgency and impact, ensuring that the inmate's immediate medical needs are addressed first through appropriate channels. Communication and collaboration with medical staff and supervisors are crucial throughout this process to ensure coordinated and effective response. Documentation of the incident and the actions taken is also a vital part of professional practice. Question 4. Examination of the data shows that the current medical unit within the correctional facility operates with protocols that reflect a blend of historical approaches to inmate management and contemporary healthcare standards. An officer specializing in medical care is tasked with evaluating the effectiveness of these protocols. Which of the following reflects the most informed understanding of the evolution of correctional systems and its impact on medical care within this context? Option A. The officer should primarily rely on anecdotal evidence and established practices from the mid-20th century correctional medical units, as these represent a stable and proven model for inmate healthcare that has largely remained effective. Option B. The officer should advocate for protocols that strictly limit medical services to only life-threatening emergencies, reflecting a historical perspective where inmate health was considered a secondary concern to security and punishment. Option C. The officer should focus on implementing protocols that mirror the strict discipline and minimal resource allocation characteristic of early penal institutions, as this historical approach prioritized institutional control and cost efficiency, which remain paramount in correctional operations. Option D. Recognizing that historical correctional systems often viewed inmates as solely punitive subjects, the officer should prioritize advocating for protocols that align with modern correctional healthcare standards, emphasizing rehabilitation and the constitutional right to adequate medical care, as this reflects the significant evolution towards a more humane and rights-conscious system. The correct answer is D. Recognizing that historical correctional systems often viewed inmates as solely punitive subjects, the officer should prioritize advocating for protocols that align with modern correctional healthcare standards, emphasizing rehabilitation and the constitutional right to adequate medical care, as this reflects the significant evolution towards a more humane and rights-conscious system. Explanation. This scenario presents a professional challenge due to the inherent tension between evolving correctional philosophies and the practical realities of managing a medical unit within a system that may still retain vestiges of older, less rehabilitative models. A correctional officer specializing in medical care must navigate these historical influences to ensure patient-centered care while adhering to current standards and regulations. The challenge lies in recognizing how historical approaches to inmate management, which often prioritized punishment over rehabilitation or healthcare, can subtly impact contemporary practices, potentially leading to understaffing, inadequate resources, or a less empathetic approach to inmate health needs. The correct approach represents best professional practice because it demonstrates an understanding of the historical context of correctional systems and how this evolution has shaped current medical care standards. By advocating for evidence-based practices and recognizing the shift towards a more therapeutic and rights-conscious model of correctional healthcare, the officer aligns with the principles of modern correctional administration and medical ethics. This proactive stance ensures that inmate health is treated with the seriousness it deserves, moving beyond historical punitive frameworks to embrace a system that acknowledges the medical needs of individuals in custody, as mandated by contemporary regulations and case law that emphasize the constitutional right to adequate medical care. An incorrect approach that focuses solely on the punitive aspects of historical correctional systems would fail to recognize the advancements in correctional healthcare and the legal obligations to provide care. This would represent a significant regulatory and ethical failure, as it ignores the established rights of inmates and the professional standards expected of medical personnel within correctional facilities. Such an approach could lead to the denial of necessary medical treatment, inadequate care, and potential legal repercussions for the facility and its staff. Another incorrect approach that prioritizes cost-saving measures above all else, drawing from historical models where inmate welfare was secondary to institutional budgets, would also be a failure. This overlooks the ethical imperative to provide quality healthcare regardless of cost and the legal ramifications of failing to do so. Modern correctional systems, while mindful of budgets, are bound by regulations that mandate a certain standard of care, making cost-cutting at the expense of patient well-being a direct violation. A third incorrect approach that relies on outdated protocols or anecdotal evidence from earlier correctional eras, without referencing current medical guidelines or legal precedents, would be professionally unacceptable. This demonstrates a lack of commitment to continuous learning and adherence to contemporary best practices, potentially leading to substandard care, and a failure to meet the evolving needs of the inmate population. The professional decision-making process for similar situations should involve a critical assessment of the current operational environment, an understanding of the historical trajectory of correctional systems and their impact on healthcare, and a thorough knowledge of current regulations, ethical guidelines, and medical best practices. This requires a commitment to ongoing professional development, a willingness to advocate for necessary resources and changes, and the ability to apply this knowledge to ensure the provision of high-quality, ethical medical care within the correctional setting. Question 5. Performance analysis shows a certified correctional officer, CCO, in the medical unit is tasked with escorting an inmate to a treatment room for an urgent medical assessment. The inmate, who has a known history of trauma, expresses significant distress and explicitly requests that only female medical personnel be present during the examination, citing personal privacy concerns. The supervising correctional officer, prioritizing immediate security and efficiency, orders the CCO to proceed with the escort and ensure the examination occurs without delay, regardless of the inmate's specific requests regarding personnel gender. What is the most ethically appropriate course of action for the CCO in this situation? Option A. Immediately escort the inmate to the treatment room as ordered, ensuring the examination proceeds without delay, and address the inmate's concerns about personnel gender after the medical assessment is complete. Option B. Escort the inmate to the treatment room and then discreetly inform the medical staff of the inmate's request, leaving it to them to manage the situation with the inmate. Option C. Refuse to escort the inmate, citing the inmate's distress and the potential for a privacy violation, and inform the supervising officer that the escort cannot proceed under these conditions. Option D. Politely inform the supervising officer of the inmate's specific request and advocate for a compromise that respects the inmate's privacy while still ensuring timely medical care, such as confirming the availability of female medical staff or exploring if a brief delay for reassignment is feasible and medically safe. The correct answer is D. Politely inform the supervising officer of the inmate's specific request and advocate for a compromise that respects the inmate's privacy while still ensuring timely medical care, such as confirming the availability of female medical staff or exploring if a brief delay for reassignment is feasible and medically safe. Explanation: this scenario presents a significant ethical challenge for a certified correctional officer, CCO, in a medical unit due to the inherent conflict between maintaining security and ensuring patient privacy and dignity. The officer is placed in a position where a direct order from a superior conflicts with established ethical principles and potentially regulatory guidelines regarding patient confidentiality. The need for immediate medical attention for an inmate, coupled with the inmate's expressed desire for privacy, creates a complex situation requiring careful judgment. The correct approach involves prioritizing the inmate's right to privacy and dignity while still ensuring their medical needs are met. This aligns with the ethical principle of patient autonomy and the regulatory framework that governs correctional health care, which emphasizes treating inmates with respect and protecting their personal information. The CCO should advocate for the inmate's wishes by seeking alternative solutions that respect privacy, such as ensuring only essential medical personnel are present or exploring less intrusive methods of assessment if medically appropriate and safe. This demonstrates a commitment to ethical practice and patient-centered care within the correctional environment. An incorrect approach would be to immediately disregard the inmate's wishes and proceed with the examination under duress or to simply refuse to assist, thereby potentially compromising the inmate's health or creating a security risk. Disregarding the inmate's expressed desire for privacy without proper justification or consultation violates the ethical principle of autonomy and potentially breaches confidentiality regulations. Refusing to assist without attempting to find a resolution could lead to a failure to provide necessary medical care, which is a dereliction of duty. Another incorrect approach would be to escalate the situation unnecessarily by immediately involving higher security personnel without first attempting to de-escalate or find a compromise that respects the inmate's privacy and medical needs. This could lead to an unnecessary use of force or a breakdown in the therapeutic relationship between medical staff and the inmate. Professionals should employ a decision-making framework that begins with identifying the ethical conflict. They should then consult relevant policies, regulations, and ethical codes. Next, they should consider the potential consequences of each course of action for the inmate, themselves, and the institution. Finally, they should choose the action that best upholds ethical principles, respects individual rights, and ensures the safety and well-being of all involved, while seeking guidance from supervisors or ethics committees when uncertainty exists. Question 6. The audit findings indicate a correctional officer in the medical unit was observed assisting an inmate with a minor injury without donning appropriate personal protective equipment, PPE, such as gloves and a mask, despite the inmate having a visible cut. What is the most appropriate immediate course of action for a supervising correctional officer? Option A. Note the observation for a later informal discussion with the officer, as the situation was perceived as low risk and the officer is experienced. Option B. Allow the officer to complete the task without intervention, given the perceived urgency of attending to the inmate's injury, and address it during the next scheduled staff training session. Option C. Immediately instruct the officer to cease the interaction and don the required PPE before continuing, and then provide a brief, direct reminder of the relevant PPE protocols. Option D. Assume the officer is aware of the correct procedure and will correct their own behavior moving forward without direct intervention. Correct answer is C. Immediately instruct the officer to cease the interaction and don the required PPE before continuing, and then provide a brief, direct reminder of the relevant PPE protocols. Explanation: scenario analysis. This scenario presents a common challenge in correctional medical units where adherence to established protocols for personal protective equipment, PPE usage, can be compromised by perceived urgency or familiarity. The audit findings highlight a potential breakdown in a critical safety procedure, impacting both staff and inmate well-being. The professional challenge lies in balancing immediate operational needs with the non-negotiable requirement for consistent and correct PPE application, as mandated by correctional health standards. Correct approach analysis. The correct approach emphasizes immediate and direct intervention to reinforce proper PPE protocols. This aligns with the fundamental principles of correctional healthcare, which prioritize the prevention of disease transmission and the safety of all individuals within the facility. Specifically, correctional regulations and guidelines, such as those governing infectious disease control and occupational safety within correctional institutions, mandate that all personnel, regardless of their experience or the perceived urgency of a situation, must utilize appropriate PPE when indicated. This approach ensures that established safety barriers are maintained, minimizing the risk of exposure to bloodborne pathogens or other communicable diseases. It also serves as a crucial teaching moment, reinforcing the importance of these protocols for ongoing safety. Incorrect approaches analysis. One incorrect approach involves overlooking the observed lapse in PPE usage due to the perceived urgency of the situation. This is a significant regulatory and ethical failure. Correctional health standards and occupational safety regulations are designed to prevent harm, and bypassing them, even for a perceived immediate need, creates a direct risk of exposure for both the officer and potentially other inmates and staff. It undermines the integrity of infection control measures and can lead to outbreaks or individual infections, violating the duty of care owed to all within the correctional environment. Another incorrect approach is to address the issue informally and at a later time without immediate correction. This also represents a regulatory and ethical failure. While informal feedback can be valuable, it is insufficient when a critical safety protocol has been breached in real time. The risk of transmission or exposure is immediate, and delaying corrective action allows that risk to persist. Furthermore, it fails to provide immediate reinforcement of the correct procedure, potentially normalizing the incorrect behavior. A third incorrect approach might be to assume the officer is aware of the correct procedure and will self-correct without intervention. This is a dangerous assumption and a failure to uphold supervisory responsibilities. Correctional environments require proactive oversight to ensure compliance with safety regulations. Relying on self-correction in a high-risk environment like a medical unit, where exposure risks are amplified, is a dereliction of duty and a violation of the principles of a safe correctional environment. Professional reasoning. Professionals in a correctional medical unit should employ a decision-making framework that prioritizes immediate safety and regulatory compliance. This involves 1. Observation, actively observing staff practices for adherence to protocols. 2. Immediate intervention. If a deviation from protocol is observed, address it directly and immediately, explaining the correct procedure. 3. Reinforcement. Provide clear and concise instruction on the correct protocol and its importance. 4. Documentation. Document the observation and intervention as per facility policy, especially if it's a recurring issue or a significant breach. 5. Follow-up. Ensure the officer understands and consistently applies the correct protocol in future situations. This systematic approach ensures that safety is paramount and that regulatory requirements are met proactively. Question 7. Analysis of a situation where a correctional officer observes an inmate exhibiting signs of distress, including difficulty breathing and disorientation. The officer contacts the medical unit via radio, reporting the symptoms. The responding nurse requests the inmate be brought to the clinic immediately for assessment. The correctional officer, citing a scheduled inmate count that is about to commence and the need for all officers to be present, states they will bring the inmate after the count is completed in approximately 30 minutes. Which of the following actions by the correctional officer best demonstrates adherence to correctional officer responsibilities in coordinating with medical staff? Option A. Attempting to provide basic first aid to the inmate while waiting for the count to finish, and then escorting the inmate to the clinic. Option B. Informing the nurse that the inmate count takes precedence, and the inmate will be brought to the clinic after the count is finished. Option C. Immediately escorting the inmate to the medical unit as requested by the nurse, and then informing the control center of the delay in count completion due to a medical emergency. Option D. Contacting a supervisor to ask for guidance on whether to prioritize the inmate count or the medical request. The correct answer is C. immediately escorting the inmate to the medical unit as requested by the nurse, and then informing the control center of the delay in count completion due to a medical emergency. Explanation. This scenario presents a common challenge in correctional medical units, balancing the immediate medical needs of an inmate with the security protocols and operational demands of the correctional facility. The professional challenge lies in ensuring effective communication and collaboration between correctional officers and medical staff, as both roles are critical to the inmate's well-being and the overall safety of the institution. Misunderstandings or breakdowns in this coordination can lead to delayed care, security breaches, or staff conflict. The correct approach prioritizes clear, direct, and timely communication regarding the inmate's condition and the specific assistance required from correctional officers. This aligns with the fundamental principles of correctional healthcare, which emphasize patient safety, continuity of care, and the integration of medical services within the secure environment of a correctional facility. Specifically, it reflects the correctional officer's duty to facilitate access to medical care while respecting the medical staff's professional judgment and expertise. This approach ensures that the inmate receives appropriate medical attention without compromising institutional security. An incorrect approach that involves the correctional officer unilaterally deciding the urgency of the medical issue or dictating the course of treatment would be a failure to respect the scope of practice of medical professionals. This undermines the authority of the medical unit and could lead to inappropriate medical decisions. Another incorrect approach, such as delaying notification to medical staff due to perceived minor inconveniences or other duties, violates the ethical and regulatory obligation to provide timely medical care to inmates. This could result in the exacerbation of a medical condition and potential harm to the inmate. Furthermore, failing to document the interaction or the inmate's condition accurately would be a breach of record-keeping standards and could have legal and administrative repercussions. Professional reasoning in such situations requires a systematic approach. First, assess the information received. What is the inmate's reported complaint, and what is the immediate observable situation? Second, determine the appropriate point of contact within the medical unit based on the nature of the complaint. Third, communicate clearly and concisely with the medical staff, providing all relevant details. Fourth, follow the instructions of the medical staff regarding inmate management and escort. Finally, ensure all actions are documented according to facility policy. This process ensures that security concerns are addressed while prioritizing the inmate's medical needs through proper interdepartmental coordination. Question 8. The control framework reveals that a new inmate is being processed into the medical unit for an initial health screening. The inmate appears calm, states they are in good health, and expresses a desire to complete the process quickly. What is the most appropriate course of action for the correctional officer to ensure compliance with health screening protocols? Option A. Briefly ask a few general questions about well-being and then proceed with the screening, assuming most inmates will report being healthy. Option B. Conduct a full health screening, including a review of available medical history, a visual assessment for any signs of injury or distress, and a verbal inquiry about specific symptoms, regardless of the inmate's stated health or desire for speed. Option C. Inform the inmate that the screening is mandatory, and if they do not cooperate fully, they will face disciplinary action. Then proceed with a shortened screening. Option D. Accept the inmate's verbal assurance of good health and proceed to the next step in the processing, documenting that the inmate reported no health concerns. Correct answer is B. Conduct a full health screening, including a review of available medical history, a visual assessment for any signs of injury or distress, and a verbal inquiry about specific symptoms, regardless of the inmate's stated health or desire for speed. Explanation. Scenario analysis. This scenario presents a common challenge in correctional healthcare, balancing the need for thorough health screenings with the operational realities of a correctional facility, including time constraints and inmate cooperation. The correctional officer must adhere to established protocols while also recognizing potential deviations that could impact an inmate's health and safety. The challenge lies in interpreting the inmate's behavior and physical presentation within the context of a mandated screening process, ensuring that no critical health indicators are missed due to assumptions or expediency. Correct approach analysis. The correct approach involves a systematic and observant process that aligns with the Certified Correctional Officer (CCO) Medical Unit Specialization's mandate for conducting health screenings. This approach prioritizes the inmate's well-being by ensuring all required components of the screening are addressed, even when faced with an inmate who appears outwardly healthy or uncooperative. It reflects best professional practice by adhering to the regulatory framework that dictates comprehensive initial assessments to identify potential health issues, regardless of the inmate's presentation. This includes a thorough review of the inmate's medical history, a physical observation for any signs of distress or injury, and a verbal inquiry about current health concerns, all documented according to facility policy. This ensures a baseline understanding of the inmate's health status upon entry or at the time of screening, which is crucial for ongoing care and management within the correctional environment. Incorrect approaches analysis. One incorrect approach involves solely relying on the inmate's verbal assertion of being healthy and skipping further assessment. This fails to meet the regulatory requirement for a comprehensive health screening. Ethically, it breaches the duty of care owed to the inmate, potentially leading to the exacerbation of undiagnosed conditions. Another incorrect approach is to proceed with the screening, but rush through it due to perceived time pressures, neglecting to ask specific questions about symptoms or conduct a thorough visual inspection. This violates established protocols for health screenings and can result in misdiagnoses, which is a significant regulatory and ethical failure. Finally, an approach that involves making assumptions about the inmate's health based on their demeanor or prior interactions, without conducting the mandated screening, is also professionally unacceptable. This demonstrates a lack of adherence to the control framework and can lead to serious health consequences for the inmate, undermining the core responsibilities of a correctional officer in a medical unit. Professional reasoning. Professionals in this role should employ a decision-making process that begins with a clear understanding of the governing regulatory framework and facility policies for health screenings. This involves recognizing that every inmate requires a standardized, comprehensive assessment upon entry or at designated intervals, irrespective of their outward appearance or stated health status. The process should include a structured set of questions, a physical observation checklist, and a clear protocol for documentation. When faced with an uncooperative or seemingly healthy inmate, the professional should not deviate from the protocol, but rather adapt their approach to elicit necessary information while maintaining professionalism and adherence to policy. This might involve employing de-escalation techniques or seeking assistance from medical staff if the inmate's behavior poses a significant barrier to assessment. The ultimate goal is to ensure the inmate's health is accurately assessed and documented, fulfilling both regulatory obligations and ethical responsibilities. Question 9. Strategic planning requires a comprehensive approach to managing hazardous materials and biohazard waste within a correctional medical unit. Considering the unique environment and potential risks, which of the following strategies best optimizes the process for ensuring safety and regulatory compliance? Option A. Utilizing standard refuse bins for all medical waste, assuming that the volume of hazardous material is negligible and poses no significant risk. Option B. Storing all biohazard waste in a single, unmarked container in a designated area until a sufficient quantity accumulates for disposal to minimize the frequency of waste removal. Option C. Implementing a multi-stage containment and segregation system for all hazardous materials and biohazard waste, coupled with rigorous staff training on identification, handling, and disposal protocols, and establishing a clear schedule for regular, secure transportation to approved disposal facilities. Option D. Relying on the inherent caution of medical staff to manage waste, with informal guidance provided on an as-needed basis for handling potentially hazardous materials. Correct answer is C. Implementing a multi-stage containment and segregation system for all hazardous materials and biohazard waste, coupled with rigorous staff training on identification, handling, and disposal protocols, and establishing a clear schedule for regular, secure transportation to approved disposal facilities. Explanation. This scenario is professionally challenging because it involves the potential for serious health risks to correctional staff, inmates, and the public if hazardous materials and biohazard waste are not managed according to strict protocols. The correctional environment presents unique difficulties due to the confined space, the presence of a vulnerable population, and the need to maintain security while implementing medical procedures. Careful judgment is required to balance these competing demands and ensure compliance with all applicable regulations. The correct approach represents best professional practice because it prioritizes the safety of all individuals within the correctional facility and the surrounding community. It aligns with the fundamental principles of public health and occupational safety, ensuring that hazardous materials and biohazard waste are identified, segregated, stored, transported, and disposed of in a manner that minimizes exposure and environmental contamination. This approach is directly supported by regulations governing the handling of medical waste and hazardous substances in correctional settings, which mandate specific procedures to prevent the spread of infection and disease. Adherence to these protocols is not only an ethical imperative, but also a legal requirement to avoid penalties and maintain the integrity of the correctional medical unit. An incorrect approach that involves improvising containment methods for biohazard waste demonstrates a failure to adhere to established protocols. This could lead to accidental spills, cross-contamination, and exposure to infectious agents, violating regulations designed to protect health and safety. Another incorrect approach, such as delaying the disposal of hazardous materials due to perceived inconvenience, poses a significant risk of degradation of containment integrity and potential environmental release, contravening regulations that specify timely and secure disposal. Finally, an approach that neglects proper labeling and documentation of hazardous waste creates a risk of mishandling during transport or disposal, potentially leading to improper treatment or exposure to personnel unfamiliar with the contents, which is a direct violation of tracking and safety mandates. Professionals should employ a decision-making framework that begins with a thorough understanding of all relevant regulations and facility policies concerning hazardous materials and biohazard waste. This includes identifying the specific types of waste generated, their associated risks, and the required containment, labeling, and disposal procedures. When faced with a situation requiring a decision, professionals should always default to the safest and most compliant option, even if it appears more time-consuming or resource-intensive. This involves consulting with supervisors or designated safety officers when uncertainty exists and prioritizing training and education to ensure all staff are competent in handling these materials. A proactive approach, focusing on prevention and preparedness, is crucial in mitigating risks within the correctional medical unit. Question 10. Research into a sudden increase in inmate requests for medical attention within the correctional facility's medical unit, with some correctional staff expressing skepticism about the urgency of these requests, requires an assessment of the most appropriate response to ensure both inmate welfare and facility security. Which of the following actions best reflects the professional and regulatory requirements for managing such a situation? Option A. Dismiss the majority of the requests as potentially non-urgent based on the observations of correctional staff, and only address those that appear immediately life-threatening. Option B. Immediately consult with the medical staff to assess the nature and urgency of each request, document the situation and the actions taken, and follow established protocols for resource allocation and escalation based on medical advice. Option C. Prioritize addressing requests from inmates who are known to be frequent users of the medical services, as they are more likely to be exaggerating their symptoms. Option D. Initiate a facility-wide lockdown and require all inmates to return to their cells until the medical unit can process the backlog of requests. Correct answer is B. Immediately consult with the medical staff to assess the nature and urgency of each request, document the situation and the actions taken, and follow established protocols for resource allocation and escalation based on medical advice. Explanation. This scenario presents a professional challenge due to the critical need to balance immediate medical needs with the security and operational demands of a correctional facility. A sudden surge in medical requests, particularly those perceived as non-urgent by some staff, can strain limited resources, including medical personnel, equipment, and space within the medical unit. The correctional officer's role is to ensure the safety and security of the facility while also facilitating appropriate medical care. Misjudging the urgency or nature of a medical request can lead to delayed care for a serious condition or unnecessary disruption to facility operations. Careful judgment is required to assess the situation objectively, gather necessary information, and implement a response that upholds both inmate welfare and institutional security. The correct approach represents best professional practice because it prioritizes a systematic and evidence-based assessment of the situation. By immediately consulting with the medical staff to understand the nature and urgency of the requests, the officer ensures that medical expertise guides the response. This aligns with correctional regulations that mandate providing adequate medical care to inmates and emphasize the importance of collaboration between correctional and medical personnel. Furthermore, documenting the situation and the actions taken is a fundamental requirement for accountability and future review, ensuring that all decisions are transparent and justifiable within the established legal and policy framework. This approach upholds the ethical obligation to provide care while maintaining operational integrity. An incorrect approach that involves dismissing the requests outright without medical consultation fails to meet the regulatory requirement to provide necessary medical attention. This could lead to a serious health deterioration for an inmate, potentially resulting in legal repercussions for the facility and the officer. Another incorrect approach, that of immediately escalating all requests to the highest security alert without medical validation, could lead to unnecessary lockdowns, staff deployment, and inmate disruption, thereby undermining efficient facility operations and potentially creating a climate of distrust. This demonstrates a failure to exercise professional judgment and to collaborate effectively with medical personnel, which is a cornerstone of effective medical unit operations within a correctional setting. The professional decision-making process for similar situations should involve a clear protocol for triaging medical requests. This protocol should empower correctional officers to gather initial information and, crucially, to consult with medical staff to determine the appropriate level of response. The process should emphasize clear communication channels, the importance of objective assessment over subjective assumptions, and the necessity of documentation. When faced with a surge in requests, officers should follow established procedures for resource allocation and escalation, always prioritizing inmate health while considering the overall security and operational needs of the institution. Question 11. The performance metrics show a slight increase in inmate complaints regarding respiratory distress and chest pain. An inmate with a documented history of coronary artery disease reports sudden onset of severe shortness of breath and sharp chest pain, stating it feels different than his usual angina. Which of the following actions best reflects the appropriate response for a certified correctional officer in this situation? Option A. Document the complaint and inform the inmate that he will be seen by medical staff during their next scheduled rounds, as this is not an immediate emergency. Option B. Immediately escort the inmate to the medical unit for urgent evaluation by qualified medical personnel and report the specific symptoms and his medical history. Option C. Suggest the inmate try deep breathing exercises to manage his anxiety, as chest pain can often be psychosomatic in correctional settings. Option D. Advise the inmate to rest and take his prescribed nitroglycerin, and monitor him for a few hours before reporting to the medical unit if symptoms persist. The correct answer is D. Advise the inmate to rest and take his prescribed nitroglycerin, and monitor him for a few hours before reporting to the medical unit if symptoms persist. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a correctional officer to differentiate between two distinct types of medical conditions, acute and chronic, based on observed inmate behavior and reported symptoms. Misidentification can lead to delayed or inappropriate medical intervention, potentially exacerbating the inmate's condition, causing unnecessary suffering, and creating security risks within the facility. The officer must rely on their training and observational skills to make a rapid, yet accurate assessment in a high-stress environment. Correct approach analysis. The correct approach involves recognizing that the inmate's reported shortness of breath and chest pain, coupled with a history of heart disease, strongly suggests an acute exacerbation of a chronic condition or a new acute event. This aligns with best professional practice by prioritizing immediate medical evaluation for potentially life-threatening symptoms. The regulatory framework for correctional healthcare emphasizes prompt assessment and treatment of emergent conditions. The officer's duty is to report these symptoms to medical staff without delay, allowing for a professional medical diagnosis and management plan. This proactive reporting ensures the inmate receives timely care and minimizes potential complications, adhering to the principle of providing adequate medical care within the correctional setting. Incorrect approach is analysis. One incorrect approach is to dismiss the symptoms as a minor issue or a behavioral problem without proper medical assessment. This fails to acknowledge the potential severity of acute cardiac events and violates the ethical obligation to provide necessary medical care. It could also be a failure to adhere to facility protocols for reporting inmate medical complaints, potentially leading to disciplinary action and a breach of inmate welfare standards. Another incorrect approach is to attempt to self-diagnose or treat the inmate based on assumptions about their chronic condition. Correctional officers are not medical professionals and are not authorized or trained to make medical diagnoses or prescribe treatment. This action constitutes practicing medicine without a license, a serious legal and ethical violation. It bypasses the established chain of medical command and could result in incorrect treatment, worsening the inmate's condition, and exposing the officer and the facility to significant liability. A third incorrect approach is to delay reporting the symptoms due to a perceived lack of urgency or a belief that the inmate is exaggerating. This demonstrates a failure to understand the potential rapid progression of acute medical conditions, particularly cardiac issues. Such a delay could have catastrophic consequences for the inmate's health and survival, representing a gross negligence and a violation of the duty of care owed to all inmates. It also undermines the trust and effectiveness of the medical unit by withholding critical information. Professional reasoning. When faced with inmate medical complaints, correctional officers should follow a clear decision-making process. 1. Observe and listen carefully to the inmate's reported symptoms and any observable signs. 2. Consider any known pre-existing medical conditions. 3. Differentiate between symptoms suggestive of an acute emergency versus those that might be part of a stable chronic condition. 4. Prioritize reporting any symptoms that indicate a potential acute or life-threatening condition to the medical unit immediately. 5. Document the interaction and the reported symptoms accurately. This systematic approach ensures that inmate medical needs are addressed promptly and appropriately, adhering to both regulatory requirements and ethical standards of care. Question 12. Compliance review shows a correctional officer in the medical unit observes an inmate exhibiting signs of distress, including labored breathing and disorientation, but the inmate is also verbally aggressive and appears agitated. The officer is alone in the immediate vicinity. What is the most appropriate immediate course of action to ensure both officer safety and the inmate's well-being? Option A. Attempt to physically restrain the inmate to prevent them from harming themselves or others while waiting for medical staff. Option B. Advise the inmate to calm down and wait for their behavior to stabilize before seeking medical attention. Option C. Ask another inmate in a nearby cell if they know what is wrong with the distressed inmate. Option D. Immediately request medical assistance and appropriate security backup while maintaining a safe distance and observing the inmate's condition. The correct answer is D. Immediately request medical assistance and appropriate security backup while maintaining a safe distance and observing the inmate's condition. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the correctional officer to balance the immediate need for medical attention for an inmate with the inherent risks of managing a potentially volatile situation within a correctional environment. The officer must assess the situation quickly, considering the inmate's condition, potential for aggression, and the availability of resources, all while adhering to strict safety protocols designed to protect both staff and inmates. Failure to act decisively could lead to a worsening medical condition, while an improperly managed response could result in injury to the officer or others. Correct approach analysis. The correct approach prioritizes the immediate safety of the correctional officer and other staff by initiating a controlled response that involves requesting appropriate backup and medical personnel. This aligns with occupational safety standards that mandate a systematic and secure approach to handling medical emergencies involving inmates, particularly those with potential behavioral issues or unknown medical histories. The emphasis on securing the area and awaiting trained medical staff ensures that the inmate receives proper care without compromising the safety of the correctional facility. This reflects best professional practice by adhering to established protocols for inmate medical emergencies, which are designed to mitigate risks and ensure a coordinated, safe response. Incorrect approaches analysis. One incorrect approach involves directly attempting to administer aid without first securing the scene or requesting backup. This violates occupational safety standards by exposing the officer to unnecessary risk. Correctional environments are inherently unpredictable, and an inmate experiencing a medical crisis could become agitated or violent, posing a direct threat. Failing to involve trained medical personnel immediately also means the inmate may not receive the most appropriate care, potentially exacerbating their condition. Another incorrect approach is to delay medical assistance until the inmate's behavior stabilizes, assuming the condition is not immediately life-threatening. This is a critical failure of both occupational safety and inmate care standards. Correctional officers are not medical professionals, and delaying necessary medical intervention based on a non-medical assessment can have severe, even fatal, consequences for the inmate. Furthermore, it demonstrates a disregard for the inmate's well-being and a failure to follow established emergency response protocols. A third incorrect approach is to rely solely on other inmates for assistance or information regarding the medical emergency. This is a severe breach of safety protocols. Inmates are not authorized or trained to provide medical assistance or reliable situational assessments in emergencies. Their involvement introduces significant risks of miscommunication, further endangerment of the situation, and potential for manipulation or escalation. It also bypasses the established chain of command and the requirement for professional medical assessment and intervention. Professional reasoning. Professionals in this situation should employ a decision-making framework that begins with immediate threat assessment. This involves quickly evaluating the inmate's condition and the immediate environment for any signs of danger. The next step is to activate established emergency protocols, which typically involve calling for medical assistance and appropriate security backup. Simultaneously, the officer should attempt to secure the immediate area if safe to do so, maintaining a safe distance while observing the inmate. Communication is paramount throughout the process, ensuring clear and concise updates are provided to responding units. The principle of safety first, for both staff and inmates, guides every action, ensuring that the response is controlled, professional, and compliant with all relevant regulations and guidelines. Question 13. Which approach would be most effective and compliant for a certified correctional officer, CCO, specializing in the medical unit to ensure adherence to prescribed oral medications for an inmate? Option A. Focus on ensuring the correct number of pills are dispensed from the medication cart to the inmate's possession. Option B. Instruct another inmate to supervise the medication ingestion and report back to the correctional officer. Option C. Accept the inmate's verbal confirmation that they have taken their medication and document this confirmation. Option D. Directly observe the inmate ingesting the prescribed oral medication and document the observation in the inmate's medical record. The correct answer is D. Directly observe the inmate ingesting the prescribed oral medication and document the observation in the inmate's medical record. Explanation. This scenario presents a professional challenge due to the critical nature of medication administration and adherence monitoring within a correctional facility. Ensuring patient safety, therapeutic efficacy, and compliance with institutional policies and relevant correctional healthcare regulations are paramount. The correctional officer must balance the need for timely and accurate medication delivery with the inherent security and logistical constraints of the environment. Careful judgment is required to identify the most effective and compliant method for monitoring adherence, which directly impacts patient outcomes and institutional liability. The correct approach represents best professional practice because it prioritizes a systematic, documented, and patient-centered method for medication administration and adherence monitoring. This aligns with correctional healthcare standards that emphasize accurate record-keeping, patient education, and verification of medication intake. By directly observing the patient ingest the medication and documenting this observation, the officer ensures accountability and minimizes the risk of diversion or non-adherence. This practice is supported by correctional healthcare guidelines that mandate clear procedures for medication administration and require evidence of patient compliance. An incorrect approach that relies solely on the patient's verbal confirmation without direct observation fails to meet the standard of care. This introduces a significant risk of non-adherence, diversion, or the patient not actually taking the medication as prescribed, which can lead to treatment failure, adverse health events, and potential legal repercussions for the facility. Such an approach would violate correctional healthcare regulations requiring verifiable administration. Another incorrect approach that involves delegating the direct observation of medication ingestion to another inmate is a severe breach of protocol and ethical standards. Inmates are not authorized or trained personnel for medication administration or monitoring. This practice creates an unacceptable risk of medication errors, diversion, and compromise of patient confidentiality, directly contravening correctional healthcare policies and patient safety mandates. A third incorrect approach that focuses on the quantity of medications dispensed rather than the observed ingestion is also professionally unacceptable. While inventory management is important, it does not confirm that the patient actually received and took the prescribed medication. The core responsibility is to ensure the medication is administered and consumed as ordered, not merely accounted for in a supply chain. This oversight neglects the primary objective of adherence monitoring and patient well-being, failing to meet regulatory requirements for direct patient care. The professional reasoning process for similar situations should involve a thorough understanding of institutional policies, relevant correctional healthcare regulations, e.g., those governing medication administration and patient rights, and the specific medication orders. The officer should always prioritize direct observation of medication ingestion, accurate and timely documentation, and patient education regarding their medication regimen. When in doubt, seeking clarification from the medical staff is essential. The decision-making framework should be rooted in patient safety, regulatory compliance, and ethical practice. Question 14. The review process indicates a correctional officer observed an inmate experiencing a sudden and severe medical episode, exhibiting signs of distress and difficulty breathing. The officer is aware of the inmate's history of a chronic respiratory condition. The officer's immediate actions are critical in determining the outcome and legal compliance. Which of the following actions best aligns with the legal framework governing correctional facilities regarding inmate medical care and officer responsibilities? Option A. Attempt to administer over-the-counter pain medication from the correctional officer's personal supply to alleviate the inmate's discomfort. Option B. Immediately contact the medical unit and request emergency medical assistance, while simultaneously ensuring the inmate's immediate safety and securing the area to prevent further harm or disruption. Option C. Focus solely on restraining the inmate to prevent any potential escape or assault, and only report the medical issue after the inmate has been secured. Option D. Wait for the inmate's breathing to stabilize on its own before reporting the incident to medical staff, to avoid unnecessary alarm. The correct answer is B. Immediately contact the medical unit and request emergency medical assistance, while simultaneously ensuring the inmate's immediate safety and securing the area to prevent further harm or disruption. Explanation. This scenario is professionally challenging because it requires the correctional officer to balance immediate security concerns with the legal and ethical obligations to provide adequate medical care within a correctional setting. The officer must interpret and apply the legal framework governing correctional facilities, specifically concerning the rights of inmates to medical treatment and the responsibilities of the facility to provide it, while also managing potential security risks. The correct approach represents best professional practice because it prioritizes the inmate's immediate medical needs while adhering to established protocols for medical emergencies within a correctional facility. This involves recognizing the urgency of the situation, initiating appropriate emergency medical response, and ensuring proper documentation, all of which are mandated by the legal framework governing correctional health care. This approach upholds the inmate's constitutional right to medical care, as established by case law and federal regulations, and aligns with the correctional facility's duty of care. An incorrect approach that involves delaying medical attention due to perceived security risks or administrative inconvenience would represent a failure to uphold the inmate's constitutional rights. Such a delay could lead to a worsening of the inmate's condition, potentially resulting in serious harm or death, and expose the correctional facility to legal liability under the Eighth Amendment's prohibition against cruel and unusual punishment. Another incorrect approach, such as attempting to provide medical treatment without proper training or authorization, would violate facility policies and potentially endanger the inmate and the officer, as it bypasses the established chain of command and the expertise of medical professionals. A third incorrect approach, failing to document the incident thoroughly, would hinder proper investigation, accountability, and future medical care, and could be seen as an attempt to conceal negligence, which is a serious ethical and legal breach. Professionals should employ a decision-making framework that begins with assessing the immediate threat and the nature of the medical emergency. This should be followed by immediate activation of the appropriate emergency response protocol, which in a correctional setting typically involves notifying medical staff and securing the scene if necessary. Documentation should be initiated concurrently or immediately thereafter. This systematic approach ensures that both security and medical needs are addressed promptly and appropriately, in accordance with legal mandates and ethical responsibilities. Question 15. The analysis reveals that a newly established medical unit within a correctional facility is experiencing significant operational challenges, including delays in inmate access to scheduled medical appointments and difficulties in coordinating medication administration with inmate movement schedules. The unit director, a seasoned medical professional, is seeking to implement a revised operational framework. Which of the following approaches best addresses these challenges while adhering to the regulatory framework for correctional medical units? Option A. Empower the medical unit director to unilaterally establish and enforce all operational protocols, with correctional officers required to comply with medical staff directives regarding inmate movement and access to the medical unit, irrespective of existing security schedules. Option B. Delegate the primary responsibility for developing and managing the medical unit's operational flow to the correctional facility's administration, with medical staff providing input only when specifically requested by the administration. Option C. Develop and implement a comprehensive operational plan that is co-authored and regularly reviewed by a joint committee comprising medical unit staff, correctional security supervisors, and administrative representatives, with clear protocols for inmate movement, appointment scheduling, and medication delivery integrated into the facility's overall security and operational procedures. Option D. Adopt operational models and protocols used by external civilian hospitals, assuming they can be directly applied to the correctional environment without significant modification, and instruct correctional staff to adapt their security procedures accordingly. The correct answer is C. Develop and implement a comprehensive operational plan that is co-authored and regularly reviewed by a joint committee comprising medical unit staff, correctional security supervisors, and administrative representatives, with clear protocols for inmate movement, appointment scheduling, and medication delivery integrated into the facility's overall security and operational procedures. Explanation. The scenario presents a common implementation challenge in correctional medical units, balancing the need for efficient inmate care with the unique security and logistical constraints of a correctional environment. The challenge lies in adapting standard medical unit operational models to a setting where inmate movement, access to services, and staff-to-inmate ratios are heavily dictated by security protocols. Careful judgment is required to ensure that medical needs are met without compromising institutional safety or violating inmate rights. The correct approach represents best professional practice because it prioritizes a multidisciplinary team, including correctional officers and medical staff, to collaboratively develop and implement protocols. This aligns with the fundamental principles of correctional healthcare, which emphasize integrated care within the correctional setting. Specifically, it acknowledges that effective medical unit function relies on seamless communication and coordinated efforts between security and medical personnel, as mandated by correctional standards that require a holistic approach to inmate well-being. This collaborative model ensures that medical services are delivered in a manner that is both clinically sound and operationally feasible within the correctional facility, adhering to regulations that govern the provision of healthcare in detention settings. An incorrect approach that focuses solely on medical staff autonomy without integrating correctional officer input fails to recognize the inherent security requirements of the facility. This oversight can lead to protocols that are impractical or unsafe to implement, potentially compromising both inmate care and institutional security. Such an approach would violate correctional regulations that mandate cooperation between departments and may lead to delayed or inadequate medical attention due to security bottlenecks. Another incorrect approach that emphasizes strict adherence to external, non-correctional medical facility models without adaptation ignores the unique operational realities of a correctional setting. This can result in the implementation of procedures that are incompatible with inmate population management, security protocols, or the physical layout of the medical unit within the facility. This failure to adapt can lead to inefficiencies, increased risk of security breaches, and ultimately, a degradation of both medical care and safety, contravening correctional guidelines that require site-specific operational plans. A third incorrect approach that delegates all medical unit operational decisions to correctional administration without adequate medical expertise risks prioritizing security over clinical necessity. While security is paramount, medical decisions must be guided by qualified medical professionals. This approach could lead to the implementation of policies that hinder appropriate medical treatment, violate inmate health rights, or fail to meet established medical standards, thereby breaching correctional healthcare regulations and ethical obligations. The professional decision-making process for similar situations should involve a thorough assessment of the correctional facility's specific security protocols, inmate population characteristics, and available resources. It requires establishing clear lines of communication and collaboration between medical staff, correctional officers, and administration. A systematic approach to protocol development, incorporating input from all relevant stakeholders, followed by regular review and adaptation based on operational feedback and evolving medical standards, is crucial for effective and compliant medical unit functioning. Question 16. Risk assessment procedures indicate an inmate in the medical unit is exhibiting signs of severe choking, including an ability to speak, forceful coughing that is becoming weak, and a panicked expression. The inmate is conscious. What is the immediate priority first aid procedure? Option A. Attempt to visually locate and remove the object with gloved fingers immediately. Option B. Administer a liquid to help wash the object down the airway. Option C. Wait for the arrival of a physician before initiating any intervention. Option D. Administer back blows and abdominal thrusts, Heimlich maneuver, if the inmate remains conscious and unable to expel the object. The correct answer is D. Administer back blows and abdominal thrusts, Heimlich maneuver, if the inmate remains conscious and unable to expel the object. Explanation. Scenario analysis. This scenario is professionally challenging because it requires immediate, accurate assessment and intervention for a potentially serious medical emergency within a controlled, high-stress environment. The correctional officer must balance the immediate need for medical care with security protocols and the potential for the situation to escalate. The presence of a foreign object lodged in the airway presents a significant risk of asphyxiation, demanding swift and appropriate first aid. Correct approach analysis. The correct approach prioritizes immediate airway management, recognizing that without a patent airway, all other interventions are futile. This aligns with fundamental first aid principles and the implied duty of care within a correctional medical unit. Promptly administering appropriate first aid for choking, such as back blows and abdominal thrusts, Heimlich maneuver, if the individual is conscious and able to cough, or chest thrusts if they become unconscious, is the most effective way to dislodge the obstruction and restore breathing. This action directly addresses the life-threatening nature of the injury and is consistent with established emergency medical protocols for airway obstruction. Incorrect approaches analysis. One incorrect approach would be to immediately attempt to remove the object with fingers without assessing the situation or attempting to dislodge it through standard first aid. This is dangerous as it could push the object further down the airway, worsening the obstruction, and carries a risk of injury to the individual. It also bypasses established, safer protocols. Another incorrect approach would be to wait for a medical professional to arrive before initiating any intervention, assuming the situation is not immediately life-threatening. This delay is unacceptable given the clear signs of choking and the potential for rapid deterioration. The regulatory framework for correctional officers, particularly in a medical specialization, implies a responsibility to act within their scope of practice to preserve life and prevent further harm. A third incorrect approach would be to administer medication or attempt to irrigate the airway without a clear medical directive or understanding of the object's nature. This could be ineffective, cause further harm, or mask symptoms, delaying appropriate treatment. First aid for choking focuses on mechanical dislodgement, not pharmacological or irrigational interventions. Professional reasoning. Professionals should employ a systematic approach. 1. Assess the scene for safety. 2. Assess the individual's condition, specifically looking for signs of airway obstruction, inability to speak, cough, or breathe. 3. If choking is evident and the individual is conscious, initiate appropriate first aid maneuvers, back blows, abdominal thrusts. 4. If the individual becomes unconscious, initiate CPR with a focus on checking for the object in the airway before attempting rescue breaths. 5. Simultaneously, ensure that emergency medical services or a designated medical responder is being summoned. This structured approach ensures that the most critical threat, airway obstruction, is addressed first, while also preparing for further medical intervention. Question 17. The efficiency study reveals that the medical unit is experiencing significant delays in responding to non-emergency inmate medical requests, leading to increased overtime for medical staff and a perception of inefficiency. An inmate approaches you complaining of a persistent cough and mild chest discomfort, stating they have been waiting for a sick call appointment for 3 days. You are aware that the medical unit is currently short-staffed. What is the most appropriate course of action according to correctional medical care policies and procedures? Option A. Advise the inmate that due to current staffing shortages, non-emergency requests are being deprioritized and they will have to wait until a medical staff member is available. Option B. Conduct a brief personal assessment of the inmate's symptoms, and if you deem them not immediately life-threatening, instruct them to return to their cell and wait for the next scheduled sick call. Option C. Suggest the inmate try over-the-counter remedies you may have access to, as this might alleviate their symptoms and reduce the need for a medical unit visit. Option D. Immediately escort the inmate to the medical unit for a professional assessment by qualified medical personnel, and document the inmate's complaint and your action according to facility policy. The correct answer is A. Advise the inmate that due to current staffing shortages, non-emergency requests are being deprioritized and they will have to wait until a medical staff member is available. Explanation. Scenario analysis. This scenario presents a common challenge in correctional medical units, balancing limited resources with the imperative to provide adequate and timely medical care. The efficiency study highlights a potential conflict between operational cost-saving measures and the established policies and procedures designed to ensure inmate health and safety. The correctional officer's role is to uphold these policies, even when faced with pressure to deviate due to perceived inefficiencies. The professional challenge lies in recognizing that medical care is not a discretionary service, but a fundamental right and a critical component of maintaining order and security within the facility. Correct approach analysis. Adhering strictly to the established policies and procedures for medical care is the best professional practice. These policies are developed based on regulatory frameworks, legal mandates, and best practices in correctional health care. They are designed to ensure that all inmates receive appropriate medical attention, regardless of perceived resource constraints or operational pressures. Following these procedures guarantees that the officer is acting within legal and ethical boundaries, minimizing the risk of liability for the facility and ensuring the well-being of the inmate. This approach prioritizes patient safety and legal compliance above all else. Incorrect approach is analysis. Implementing a triage system that prioritizes inmates based on the perceived severity of their condition without explicit authorization or established protocol is a regulatory and ethical failure. This bypasses the established procedures for medical assessment and treatment, potentially leading to delayed or inadequate care for individuals who might not appear critically ill but still require prompt attention. It also usurps the role of qualified medical personnel in determining the urgency of care. Directly denying a medical request based on the officer's personal assessment of its necessity is a significant regulatory and ethical failure. Correctional officers are not medical professionals and are not qualified to make clinical judgments. Such an action directly violates policies that mandate the referral of all medical concerns to the medical unit for professional evaluation. This can lead to the exacerbation of treatable conditions and potential harm to the inmate. Escalating the situation to the medical unit for a formal assessment and following their guidance, even if it means a temporary disruption to other duties, is the correct course of action. This upholds the established chain of command and ensures that medical decisions are made by qualified professionals in accordance with established protocols. Professional reasoning. When faced with a situation where operational efficiency appears to conflict with established medical care policies, a correctional officer must prioritize adherence to those policies. The decision-making process should involve 1. Identifying the relevant policy and procedure for the specific medical situation. 2. Recognizing the limitations of the officer's role in medical assessment and treatment. 3. Following the established protocol for referring inmates to the medical unit. 4. communicating any concerns about resource allocation or procedural adherence through the appropriate supervisory channels, rather than unilaterally deviating from policy. The ultimate goal is to ensure inmate safety and well-being while operating within legal and ethical parameters. Question 18. During the evaluation of an inmate presenting with signs of potential substance abuse, which of the following approaches best aligns with correctional medical unit protocols for initial risk assessment and intervention planning? Option A. Conduct a comprehensive assessment including a review of medical history, current symptoms, observed behaviors, and a standardized screening tool to determine the level of risk for withdrawal, overdose, or other complications, and to inform immediate medical and therapeutic interventions. Option B. Prioritize immediate physical restraint and isolation based on the assumption that any signs of substance abuse indicate a high risk of violence or escape, delaying any medical evaluation until the inmate is deemed calm. Option C. Rely solely on the inmate's self-report regarding their substance use and desire for treatment, without conducting further objective medical or behavioral assessments. Option D. Focus primarily on observable signs of intoxication and immediately implement disciplinary measures if the inmate is found to be under the influence, deferring any medical assessment until the disciplinary process is complete. The correct answer is A. Conduct a comprehensive assessment including a review of medical history, current symptoms, observed behaviors, and a standardized screening tool to determine the level of risk for withdrawal, overdose, or other complications, and to inform immediate medical and therapeutic interventions. Explanation. This scenario presents a professional challenge due to the inherent complexity of substance abuse within a correctional setting. Correctional officers in medical units must balance security protocols with the medical and psychological needs of individuals with substance use disorders. Accurate risk assessment is paramount to ensure the safety of the individual, other inmates, and staff, while also facilitating appropriate treatment and reducing recidivism. The decision-making process requires a nuanced understanding of the individual's current state, history, and potential for withdrawal or relapse, all within the strict confines of correctional regulations and medical best practices. The correct approach emphasizes a comprehensive, multifaceted risk assessment that integrates objective data with subjective observations. This aligns with correctional medical guidelines that mandate thorough evaluations to identify immediate risks, e.g., overdose, withdrawal severity, and long-term needs, e.g., treatment planning, relapse prevention. Such an approach ensures that interventions are tailored, evidence-based, and compliant with the duty of care owed to incarcerated individuals, promoting their well-being and contributing to a safer correctional environment. An incorrect approach that relies solely on observable intoxication symptoms fails to account for the full spectrum of risks associated with substance abuse, including potential withdrawal, co-occurring mental health conditions, and the individual's history. This oversight can lead to inadequate care, potentially exacerbating medical emergencies or failing to initiate necessary treatment. Another incorrect approach that prioritizes immediate disciplinary action over medical assessment neglects the fundamental principle of providing necessary medical care to all individuals, regardless of their offense or current condition. This violates ethical obligations and potentially contravenes correctional health standards that mandate medical evaluation for all inmates presenting with health concerns. Focusing solely on the individual's stated desire for treatment without a thorough assessment risks misdiagnosis, inappropriate placement in treatment programs, and a failure to address underlying issues that may impede recovery. The professional reasoning process for such situations involves a systematic approach. First, ensuring immediate safety and stability. Second, conducting a thorough assessment using validated tools and clinical judgment. Third, collaborating with medical and mental health professionals. And fourth, developing and implementing a care plan that addresses identified risks and needs, all while adhering to institutional policies and relevant regulations. Question 19. System analysis indicates a potential biohazard has been reported in a correctional medical unit with a visible spill of an unknown substance. What is the most appropriate initial action for a certified correctional officer, CCO, to take to ensure health and safety regulations are met? Option A. Initiate a formal risk assessment process to identify the substance, evaluate the potential risks, and determine appropriate control measures. Option B. Instruct medical staff to handle the cleanup and containment without further CCO involvement. Option C. Advise all staff and inmates to ignore the spill unless symptoms of illness appear. Option D. Immediately cordon off the entire medical unit to prevent any further exposure until the substance is identified. The correct answer is A. Initiate a formal risk assessment process to identify the substance, evaluate the potential risks, and determine appropriate control measures. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the Certified Correctional Officer, CCO, to balance immediate operational needs with the imperative of ensuring a safe and healthy environment for both inmates and staff within the medical unit. The presence of a potential biohazard, even if unconfirmed, necessitates a proactive and systematic approach to risk management. Failure to adequately assess and mitigate such risks can lead to serious health consequences, regulatory violations, and compromised security. The CCO must exercise sound judgment, relying on established protocols and a thorough understanding of health and safety regulations pertinent to correctional medical environments. Correct approach analysis. The correct approach involves a systematic risk assessment process. This aligns directly with the principles of occupational health and safety regulations commonly found in correctional settings, which mandate proactive identification, evaluation, and control of hazards. Specifically, such regulations require a documented process for assessing risks, implementing control measures, and reviewing their effectiveness. By initiating a formal risk assessment, the CCO is adhering to the legal and ethical obligation to protect individuals from harm. This process ensures that decisions are evidence-based, proportionate to the identified risk, and documented for accountability and future reference. It prioritizes the health and safety of all individuals within the facility, which is a fundamental tenet of correctional officer duties. Incorrect approaches analysis. Ignoring the situation or dismissing it as a minor issue represents a direct failure to comply with health and safety regulations that require the reporting and assessment of potential hazards. This approach is ethically unsound as it prioritizes expediency over the well-being of others and could lead to the spread of infection or illness, creating a significant public health risk within the institution. Implementing immediate, unassessed containment measures without a formal risk assessment, while seemingly proactive, can be inefficient and potentially create new hazards. For example, isolating a large area without understanding the specific nature of the potential biohazard might disrupt essential services or lead to unnecessary panic. This approach bypasses the crucial step of evaluating the actual level of risk and determining the most appropriate and effective control measures, thus failing to meet regulatory requirements for a structured risk management process. Delegating the entire responsibility to medical staff without the CCO's direct involvement in the initial assessment phase is also problematic. While medical staff possess clinical expertise, the CCO has a broader responsibility for the overall safety and security of the unit, including the implementation of operational safety protocols. Health and safety regulations often place a shared responsibility for hazard identification and control, requiring correctional officers to be actively engaged in the process, not merely passive observers or delegators. Professional reasoning. When faced with a potential health and safety concern in a correctional medical unit, a CCO should employ a structured decision-making process. This begins with immediate observation and reporting of the potential hazard. Following this, the CCO must initiate a formal risk assessment, which involves identifying the hazard, evaluating its potential severity and likelihood of occurrence, and determining appropriate control measures. This assessment should be documented and, where necessary, involve consultation with relevant personnel, such as medical staff and safety officers. The control measures implemented should be proportionate to the assessed risk and regularly reviewed for effectiveness. This systematic approach ensures compliance with health and safety regulations, protects the well-being of all individuals, and maintains operational integrity within the facility. Question 20. System analysis indicates that an inmate in the general population is exhibiting signs of significant distress, including labored breathing and vocalizing severe pain, while repeatedly requesting to see the medical staff. The correctional officer on duty is aware that this inmate has a history of exaggerating symptoms to gain attention or privileges. However, the inmate's current presentation appears more severe than usual. What is the most appropriate course of action for the correctional officer? Option A. Inform the inmate that their behavior will be documented and instruct them to wait until their scheduled medical call. Option B. Advise the inmate to calm down and suggest they try to sleep it off as they may be seeking attention. Option C. Attempt to assess the inmate's symptoms and administer over-the-counter pain relief if deemed appropriate. Option D. Immediately escort the inmate to the medical unit for an urgent assessment by a qualified medical professional. The correct answer is D. Immediately escort the inmate to the medical unit for an urgent assessment by a qualified medical professional. Explanation. This scenario presents a common ethical dilemma within correctional facilities, specifically concerning the balance between inmate rights, facility security, and the provision of adequate medical care. The challenge lies in interpreting and applying established correctional policies and medical ethics when faced with conflicting demands and limited resources. A correctional officer's primary duty is to maintain order and security, but this must be balanced with the constitutional right of inmates to receive necessary medical treatment. The officer must navigate the complexities of inmate behavior, potential manipulation, and the critical nature of medical needs without overstepping their authority or compromising patient confidentiality. The correct approach prioritizes the inmate's immediate medical well-being while adhering to established protocols for medical emergencies. This involves recognizing the signs of distress, initiating the appropriate medical response chain, and ensuring that medical staff are informed and can assess the situation independently. This aligns with correctional regulations that mandate the provision of healthcare and ethical guidelines that emphasize patient advocacy and timely intervention. By ensuring medical staff are involved, the officer upholds the principle of professional medical judgment and avoids making medical decisions beyond their scope of practice. An incorrect approach would be to dismiss the inmate's complaints without proper medical evaluation, potentially leading to a worsening of their condition and a violation of the inmate's right to medical care. This could also constitute a failure to follow facility protocols for reporting medical issues, which are designed to prevent such oversights. Another incorrect approach would be to directly administer medication or attempt to diagnose the inmate's condition. This is a clear violation of the correctional officer's role, as they are not medically trained professionals, and such actions could lead to harm, legal repercussions, and a breach of medical confidentiality. Furthermore, ignoring the inmate's distress due to a belief that it might be feigned, without a medical professional's assessment, is a failure to exercise due diligence and could have severe consequences. The professional decision-making process in such situations requires a systematic approach. First, observe and assess the inmate's presentation for any immediate signs of medical distress. Second, follow established facility protocols for reporting medical concerns, which typically involves notifying the medical unit or designated medical personnel. Third, provide clear and concise information to the responding medical staff, including the inmate's behavior and observed symptoms. Fourth, maintain a professional demeanor and avoid making medical judgments. Finally, document all actions taken and observations made in accordance with facility policy. This structured approach ensures that inmate safety and medical needs are addressed appropriately, while maintaining the integrity of the correctional environment and the officer's professional boundaries.